Look, for many students, it's time for spring break and families will be heading on out. This morning, many families here in our area, they're making those final preparations for their next getaway. But as the excitement builds, health concerns, they're also on the rise. A spike in measles cases across the country, including right here in the DMV, is causing concern for many parents. So joining us this morning is Dr. Alexandra Yonts from Children's National Hospital with more. Like, how concerned do we need to be this morning as we head on out?
Hi, thank you for having me this morning. So right now we've had one measles case come through the district and two in the near surrounding Maryland areas. Um, so not reason for panic at this point, but reason to be prepared and start thinking about the best ways to protect you and your family.
What specific precautions would you recommend families take when thinking about traveling and when traveling?
Yeah, so the biggest thing that you can do now before your trip is make sure that you and your child are up to date on the MMR vaccine, the measles, mumps, and rubella. It takes about 14 days to get fully effective, and you do need 2 doses. So starting that conversation with your doctor, ideally before you go on your trip, is the best way. When you're traveling, it's never a bad idea in general to wear a mask on the airplane or in crowded airports, from protection from measles and lots of other viruses that might be circulating. And just to make sure you can enjoy your trip fully without the sniffles or fevers or anything else going on.
You know, I think we're also very familiar with how other viruses spread. I'm thinking, of course, about COVID, the last time we were also impacted. The way that measles, mumps, and rubella, for that matter, is transmitted, is that is also what, through airborne, or I know it's very infectious. How do we best protect? You said masks. Is that it? Is it skin to skin? What does it look like as far as trying to protect yourself and your kids?
Yeah, so measles is spread by respiratory droplets.
Okay.
So things that cough out, sneeze out. So masks are effective. But as you mentioned, it is highly contagious. For every one person that has measles, about 10 people could get it. In an unvaccinated group of folks, 12 to 18 people will get it. So that's one of the highest rates of secondary infection we have. So really, that protection, that masking, are really key things to do.
We just saw that picture of that measles case, but what are some of those big symptoms if you are traveling and you see it? Is it that distinct rash that we've just seen?
So the rash is definitely the most classic finding with measles. However, it comes late in the stage. So the first 4 days or so of the illness is sort of nonspecific cold symptoms, runny nose, watery eyes, things that may look like allergies even. And then on about day 4, the rash starts. And importantly, you are contagious throughout that early phase and even a little bit before that. So you may not know it's measles, leading up to the rash, but still be able to transmit it.
You know, before we let you go, just out of time, but I just found this really incredible. If you are vaccinated or protected, you should be okay, though we know that there was one case where a person did have the vaccination and came down with the case. I got this, we said if you got it before 1968, you might need to check your immunity. I went and got mine checked because I must have had that shot in 1967. My immunity was still so high that I was okay. So in this case, the vaccine really does go a long way as far as protection.
That's great. Glad to hear it.
I was nervous. I got it checked. But if you're nervous too, go ahead and get it checked. Better safe than sorry. Dr. Yonts is from Children's National Hospital. Thank you so much for joining us.
Thank you. Have a good day.
All right, you too.